And we go now to the latest in the coronavirus pandemic and the push to protect more kids from COVID-19. Pfizer requesting emergency authorization for its updated booster to protect children ages 5 to 11. The company announcing they completed the submission to the Food and Drug Administration today. The new boosters target the most common forms of the Omicron strain. The shots contain half original vaccine and half protection against the common variants. Pfizer's booster has already been approved for people 12 and up.
And COVID cases are expected to rise this fall and winter, so should Americans consider masking up to curb another COVID surge? Well, you see him here to weigh in on all this, our health editor, Dr. Partha Nandi. Dr. Nandi, we've seen this before, right? Cold weather brings people in, cases, hospitalizations go up. Should we be masking up to try to prevent a surge this time around?
I think the answer is not as clear, but here's the thing. I support public health measures that save lives. We still, Brian, have over 400 Americans dying every single day due to COVID, and that number could certainly go up this fall and winter if we don't take the virus seriously. Now, I know that many folks, many folks are tired of pandemic precautions. We see them all the time, right? But the bottom line is that masks do work. I wear masks every day at the office when I do procedures, and they do prevent the spread of COVID-19. Having said that, I really don't foresee, Brian, masks mandates coming back unless new, more dangerous variants emerge. So for now, individuals have to decide what's best for themselves and their families. They should take into consideration this, their vaccine status, age, and any underlying medical conditions. Research tells us that people who are vaccinated and boosted have a lower risk of getting severely sick and dying. Data from CDC's COVID tracker shows this, that unvaccinated people have 7 times higher risk of dying compared to those who are fully vaccinated and boosted with at least 1 booster dose. So I highly recommend folks to get fully vaccinated and then boosted, and then mask up when you're in crowded indoor spaces, right? And certainly mask if you're older, if you're immunocompromised, or if you have any underlying health conditions that place you at high risk. Don't feel, that you're embarrassing yourself because nobody else is.
And human behavior is such a factor in this too, of going, without for so long, and then the thought of going back again. This may be a refresher for many, but is there a best mask that you can recommend?
And I'll tell you, Brian, the best mask is the one that you'll wear, right? Having said that, N95 and KN95 offers the best protection, but not everyone can wear them, especially for long periods of time. I do, but not everybody can. So if you can't tolerate that kind of mask, then I would suggest a well-fitted disposable surgical mask. You may have to tuck it so it doesn't leave those gaps around the side of the face or nose. You can also wear cloth masks. You just want them to have a nose wire and be made with multiple layers of tightly woven fabric. Regardless of what mask is chosen, be sure that it fits well and covers your nose and mouth, both, to prevent leaks. Leaving one or the other exposed will not provide enough protection against this virus. And I'm sure you've seen this, Brad and Glenn, the folks that the masks are protecting their chin,
right,
or they're just over their mouth. You got to do both if you're going to do it.
If you're going to do it, go all the way.
Absolutely. And don't feel bashful. I'm often in places where nobody else has got a mask on. If you feel like you're immunocompromised or if you feel like you're at risk, you should not be shy. Just wear the mask. You're protecting yourselves and others.
All right. Dr. Nandi,
My pleasure.
For your expertise as always. Thank you. If you have a question for Dr. Nandi, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter.